Hi, I'm Maureen McGrath, registered nurse and sexual health educator with a special interest in menopause and beyond. Today we're diving into something that affects nearly half of all postmenopausal women, but yet it's rarely talked about. It's called Genitourinary Syndrome of Menopause, or GSM. I know it sounds like a new wireless plan, now with 5 GSM guaranteed to drop your estrogen levels in seconds. But seriously, GSM is real, it's common, and it can seriously impact your quality of life, and there are treatments. So what exactly is genitourinary syndrome of menopause? Well, the hallmark symptom is vaginal dryness, and that can lead to painful sex and low sexual desire. And this is why many women may stop having sex at menopause or after menopause. GSM is even more than that. You see, estrogen is the hormone regulator of every organ in the body, including the vagina. And GSM is actually a collection of symptoms and physical changes that happen to the vulva, vagina, urethra, and bladder because of that drop in estrogen levels at perimenopause, menopause, and after menopause. The symptoms of genitourinary menopause include vaginal dryness, burning, itching, painful sex, which is also known as dyspareunia. Can also have recurrent urinary tract infections and even urinary urgency or urinary incontinence. And no, it's not just a part of aging that you have to live with. We wouldn't accept some of the other medical conditions that we suffer from, like vision issues or hearing issues. So why suffer with genitourinary syndrome of menopause? Here's the deal. You blame estrogen, or rather the lack of it. Estrogen is the hormone regulator of every organ in the body. That's what keeps the vaginal tissues plump, elastic, and lubricated. And when levels drop in menopause and after, the vaginal walls will thin out, they'll have less moisture, less elasticity, and they'll become more fragile. Some women report post-coital bleeding as well. The same goes for the urethra and the bladder. You got to think of it like this. Your vagina goes from a lush rainforest to the Mojave Desert. And don't get me started on the bladder. That goes from a cooperative coworker to demanding toddler. Diagnosis is clinical, which means it's based on your symptoms and a physical exam. It's a good idea to have your healthcare provider take a look at your vaginal tissues if you're experiencing vaginal dryness. You want to make sure they're not red, pale, thin, or dry in appearance. And now for the good news. There are lots of treatment options available that work. There are non-hormonal options like vaginal moisturizers that are inserted into your vagina. They can be a suppository or a cream or a gel, and they can be used daily to keep things moist. You'll also want to use a lubricant during intimacy. There are also hormonal options that require a prescription from your doctor, like vaginal estrogen, which is low dose and topical. It comes in the form of creams, rings, and tablets. They are safe for most women and topical, so very little hormone is absorbed systemically. Then there's also DHEA and progesterone suppositories. DHEA is a precursor to estrogen. There's also laser or radiofrequency treatments. They may help restore tissue quality as well. Make sure that it's FDA approved and provider guided. And finally, there are sex toys, like this Viva Milana, which has air suction technology. It helps to increase blood flow, which equates to increased moisture. Sexual activity, whether with another person or with a device like the Viva Milana, whether solo or partnered, increases blood flow to your vaginal tissues, and that can stimulate natural lubrication and help keep your vaginal walls more elastic and more responsive. Regular stimulation through sex or a sex toy also helps to maintain healthy tissue, muscle tone, and sensation in your vaginal and pelvic area. Think of sex toys as part of your pelvic floor wellness routine. It's like yoga for your vulva. So it's a good idea to keep those vaginal tissues healthy because menopause tissues can be more fragile. So make sure your toy is non-porous, clean, and used with lube to avoid irritation or micro tears. You can clean your toys with Viva's Toy Clean Spray as well. Ladies, we have to talk about this and share this information with our mothers, sisters, friends, and daughters. GSM just isn't in your head, and it's not a life sentence. It can affect sleep, self-esteem, sexual health, and even your relationship, not to mention your pelvic floor. And for the record, it's never TMI in my clinic. If you can talk to your doctor about your sore knee, you can certainly talk to your doctor about your lady bits. So if you're experiencing dryness, pain, voiding frequently, or leaking when you laugh, cough, or sneeze, don't just stock up on panty liners and suffer in silence. There's help, there's hope, and there are solutions, and you deserve comfort. Remember, dry is for martinis, not for your vagina, and knowledge is your best lube. If this video was helpful, give it a like, share it with your friends, subscribe to the channel, and drop your questions or experiences below. I always love hearing from you. Until next time, stay curious, stay empowered, and never forget, your pleasure is your power. To order your Viva Milana, go to viva-savvy.com and use the code MM20 to get 20% off now. Thanks for tuning in. I'm Maureen McGrath, registered nurse and sexual health educator. To learn more, go to my website, maureenmcgrath.com, or tune into my podcast, Nurse Maureen's Health Show, which is available on Spotify, iTunes, or wherever you listen to your favorite podcasts. Thanks so much for tuning in.